So I want to show you the 2 sleeping positions that are recommended for patients who have an anterior approach for a total hip replacement. We want you to use these positions for 4 to 5 weeks until the incision on the front of the hip heals and is more comfortable to start laying on your involved side. So right now we're going to do 2 positions. The first one is to lay on your back side with your leg flat, and this is going to be Jay's involved side. So we're going to lay flat, and we can put a pillow. If he prefers, he needs a little help lifting that leg, he can put a pillow underneath that leg and let it rest just like that. He doesn't have to have the pillow either if he wishes not to. So we're going to help him lift his leg because that really hurts in the front of the hip otherwise. The other position, which tends to be the most comfortable for all the patients involved, and what they prefer, is we're going to lay on his non-surgical side, which is this. This is his surgical side. This is non-surgical side. So Jay, I'm going to have you gently turn. Okay. And it's okay to bend the knee and hip, whatever's comfortable, but we're going to need not 1 but 2 pillows here, because I want to very gently lift this hip. Jay, you can lift your leg, and we're going to put both of these pillows between his knee and his ankle. Okay. Straighten your knees out just a little bit for me. His knees can be straighter, his hip can be straighter, he can have them more bent to whatever's comfortable. The most important thing here is this. Bring this up a little bit. There you go. That these pillows are keeping his knee in relationship to his hip joint. This knee is equal to the hip, same plane as his hip, or slightly higher, which it is right now. That slightly higher position than your hip takes a lot of discomfort away from your hip, your surgical side, when you're sleeping at night. And this tends to be every patient's favorite position to be in for the first month or so. Again, 2 pillows between the knee and the ankle, knee higher or equal with or higher than your hip. That's what's key. If I take a pillow away, or I don't use any, and this knee drops down inside the plane of his hip, that's going to really start to hurt. And that's not a comfortable position to sleep in. So, 2 pillows. Supporting that lower leg so that knee is a little higher or as high as the hip.